session, we have Mrs. Ario Rafiat from the Community Health Practitioners Lagos Board and Lagos State Primary Health Board. We also have Professor Oshitelu Adefule, who is the chairman of the Lagos State Ministry of Health Traditional Medicine Board. These distinguished speakers will be talking to us. We will have a panel discussion on the sub-theme titled Harnessing Political Involvement, Private-Public Partnerships and Investment in Improving Maternal Health Care. And this session will be moderated by Mrs. Nkechi Ibe. Thank you so much, ma, please.
Thank you very much. Thank you very much. Standing on existing protocol, I don't have to reintroduce everybody. Let's just delve in. So we are discussing on the topic, harnessing political involvement, public-private partnership and investment in improving maternal health care. And so I will start with Dr. Oluwatoni Adeyemi. Doctor, good afternoon. How are you? Okay. My question for you is, you have expertise working with the community and currently working with the government and all of that. So the question that I have for you is, how do we sensitize the government and get their political will on solving problems peculiar to maternal health, especially as we have seen over the, I don't know if you were here when the Etifam ladies, talked about the bottlenecks that they have to undergo when they're trying to bring in, drugs and all of that. And, all of these bottlenecks, how do we sensitize government to exert political will, for a favorable outcome on maternal health? Thank you.
All right, thank you very much. Good afternoon once again. Thank you for your question. I think that what CSOs or NGOs like Safe Hands Initiative can actually do to sensitize governments to also lead the advocacy is, first and foremost, data is very important. So whatever you're doing and whatever you're presenting to government, it has to be backed with data. And what do I mean by data? Where do you get this data from? We have our data on the government side of things because we have the NHIMS where we get data from public and private facilities. However, there are sometimes you have to conduct surveys or you have to go down to the community level. A lot of people are doing this, like some of the abstracts that I met that were presented. Beyond the abstract, you should go ahead and try to disseminate some of your findings. Even if you don't want to publish it, you can disseminate, find a way to disseminate. The ministry is always open to things. Health units, we have directors in charge of that. We have a research unit also at the Ministry of Health. So some of these findings can be disseminated, and then you can move beyond your research and even go forward and have like a policy brief. And in your policy brief, what you're doing is that you're making your recommendations actionable. So after you've done your study, you've carried out studies, you found out things on the field, you've come up with recommendations, you now come up with a policy brief that you can actually present to government, and then government will listen. And if there's anything that can actually be done in the immediate, because some recommendations could be short-term, mid-term, and long-term, then they go ahead to do that. Then apart from that, your communication strategy, apart from the government, you need to have a coalition. You can't do things alone. You shouldn't do things in silos. So you should form a coalition. There are other groups, similar groups, doing what you're doing. Come together and try to use this to advance whatever you're trying to push to government. And I guess these are just some of the ways in which you can carry out your advocacy to government, but most importantly, identify your key stakeholders. Who are the stakeholders in the reproductive health sector? And that would help you go a long way in your advocacy towards maternal health. Thank you.
Let me ask Mrs. Rafia, do you think we are lacking in policy brief for the government? Do you think we are lacking in policies that can aid the government in carrying out, taking a stand when it comes to promoting maternal health in Nigeria?
Good afternoon. All protocols duly observed. Due to the nature of society, there is a lot of inconsistencies in policy making. You know, some bills would have waited for so long in the parliament, they won't be passed. Actually, they may be very beautiful bills, but due to one political preference or the other, it will not be materialized. So I think we are lacking behind.
So you're saying that the complexity of the Nigerian state is
System.
part of, yeah.
Yes.
So now speaking on stakeholders, I heard Dr. Oluwatoni talk about stakeholders. Sir, Dr. Ima Onyenuche, I want to find out how do we identify partnership and investment? How do we encourage that?
Thank you very much. Greetings, everyone. To identify important stakeholders and encourage them. First of all, the stakeholders are government. Government is stakeholder, investors, private group, like you say, even the community, where whatever project you are doing, there should be enough education of the community. Community are also stakeholders. The financial institution, wherever source of funding, if it's bank, they have become a stakeholder, you know, and even the patients. So those are stakeholders that are involved. And also there can be a technical group, like a legal framework, whatever agreement you are going into. We need lawyers, we need people who have that know-how to ensure sustainability. And so to encourage them is also to make it participatory and ensure transparency. What we have observed over time, and part of why so many policies fail because of lack of transparency, because of lack of openness, especially at the initial stage of the program. I can easily tell you, for instance, health insurance has been on for so long. Everybody talk about health, the universal health coverage, but it has not really left the book to the people. Why? People, the stakeholders are not engaged enough. You know, for instance, people in private practice see more, it's on record that they see more patients than even the government facility. So it behoves on the government that when you want to do something that will involve private-public partnership, that the stakeholders, in this case, those people who are in those underserved areas, are engaged. So both at the national and state level, you realize that something like health insurance is not working because, for instance, the Lagos state we say 350 naira, 400 naira capitation on a life. You cannot use 400 naira to treat people, and you cannot regulate the number of times they will come to the hospital. So there is no sincerity. So if you want this thing to work, at the initial time, when you are doing actuary studies, engage the people involved so that you can be able to get the actual cost and work. Otherwise, people will not show interest. Even as it is working currently, majority of the private people involved, I can tell you, are actually the ones subsidizing health. It's the private sector that is subsidizing health. But if they give you 400 naira to treat someone, and someone is sick, you know, from your training, the first thing is usually to find a way. So sometimes when you are thinking about someone getting well, you may you may go beyond, and most of the time go beyond that. So it's important there is transparency, early engagement. Then again, capacity building is important. There is training and retraining. That way you encourage the stakeholders, and then all the other things like funding and the access to fund and all the other government monitoring and evaluation, even on the part of government, is also good to, you know, it will encourage standard and something like that. Thank you.
Thank you very much, sir. That was apt. To Dr. Lateef Akinola, you see, the keynote speaker made a comment about budgeting towards the healthcare sector. And I want to find out from you, what do you think about the budgeting that has been given to the healthcare, and why what do you think could be done better to ensure that more emphasis is laid on healthcare budgeting, especially at the national level?
Good afternoon, everyone. Thank you so much for inviting me this event. Budgeting in health is complex. It's a very, very complex situation. You know, as we all know, health is expensive if you want to get quality health. Not only in Nigeria, all over the world, health is expensive. And our theme today is on maternal health. And the maternal health ratio in Nigeria is about 1,000 per 100,000 live births. So that, and you compare us with the United States or any of the developing countries where they have very, very low, most of them low 50 per. So you wonder what's different. Why do we have so much gap? We have the gap because WHO and UN in their policy books, they've made recommendation that at least 50% of your GDP should go into health services. And in Nigeria, 2.5, sometimes it can be 2.5. But when it comes to the stakeholders that will use it, then you see maybe it's about 1%. So currently, the government we have now, they are very enthusiastic with goodwill. They are budgeting, up to 5%, and that is still a far cry to the 15% that we request. And budgeting in health goes very important. Get good indices of key indicators of health, because you need it not only for maternal health, not only for reproduction, not only for neonatal health or child health. You need it for other things, adolescent. These are the areas where those spending are going. And you asked a very valid question the other time. How do we set that? And we need to show the government that, look, these are the data, when you're talking about maternal health from the US, and these are what they are doing. Yep. That extent. The maternal health is very, and what can we build out? What are the strategies we can build out? There are so many. The public sector alone cannot be able to, even if they have all the money, they don't have the capacity.
Yeah.
And all the expertise to run the system, even with the budget. But before the budget even gets to the stakeholders that we need, it's almost. Sometimes the stakeholders, they don't even know there's money around. So it is imperative that we need advocacy. We in the private sector, we need advocacy. We need to have the knowledge. We need to do our research, and we need to get our data, correct, so that we can put all the policies up and ask them, look, you are advocating for increased indices. Better indices in our health, health indices. We need. Are we spending money on IT? Are we spending on money on personnel? Personnel is important. The service providers are also important, and also the enabler. So the budget goes all that, but the current budget we have now is not.
It's not enough.
And that's where we are. Why we are where we are.
All right. Thank you very much, sir. Thank you. Brilliant. One thing is certain. The public sector cannot do it alone. The private sector cannot do it alone. And so there is need for collaboration. However, for to advance collaboration, you spoke about advocacy. And that is when I asked Dr. Tosin Majekodumi, what do you think are the most effective advocacy? Am I right? Please, sorry. Okay, sorry, Professor. Prof, what do you think are the, best advocacy initiative that the health sector can leverage to ensure that these collaborations are happening and that we are getting the desired result, especially with regards to maternal health?
Thank you very much. And I thank this setup for this summit. And I want to drive us back to the basics. When the slave traders, the colonial masters came in Nigeria, in Africa, to life and wealth. So we need to wake up. We need to wake up. We really need to wake up. We are the ones still enslaving ourselves. There's so many ways that nature has blessed us through which if we navigate, we'll be able to make ends meet. I'm saying it again, they met life and they met wealth. WHO even give us what we should do. The definition alone set at if you look at it, there's orthodox. Then you have the traditional. What that definition even tells us to do, we have not achieved. Because state is in the forefront in the whole country. There's a functioning traditional medicine board. And all the things we've been trying to do, they've been submerged, all because the national has not taken everything up as they should. We mentioned the budget. We are not true to ourselves. Now, talking about malaria, how can you treat malaria with 350 naira with the orthodox medicine? It's not possible. But it's possible with the traditional. I haven't taken any orthodox anti-malaria in the last 10 years. Not because I don't get malaria, because I know the cheaper way and less toxic way of doing. Less toxic way of treating. So we have all these resources. If only we can collaborate. Like, look at the COVID-19. Lagos State Traditional Medicine Board came up with something that most people at the top were using, but they did not announce it. It's traditional. All they will do is we claim it is occultic. It is fetish. Not everything is occultic. Not everything is fetish. Even at the creation, it's written there that devil came in between the, everything. So we need actually to see that we use our resources, our endowments to make progress. We have them. So advocacy is very important. At the same time, engage the right people to do the right thing and at the right times. Lagos State, we are soon going. Lagos State government has included traditional medicine board, traditional medicine practice in the first agenda. But then, as we all see, we're all promoting the orthodox more than our own. And until we wake up, we cannot make ends meet.
Thank you very
And
much.
we
Ma.
all do that.
Thank you very much, Ma. One takeaway is that when we talk about stakeholder engagement, the private, the public, we in the area of the private, we must also include the unorthodox, sector to ensure that that collaborative effort is met. Thank you very much, Ma. Finally, my last question is for anyone can take this question, and that is, what are the opportunities inherent currently for a private public partnership with the government and all stakeholders involved? Emma Onyuche, would you want to try on this question?
Okay, well, let me just start by saying that there's always a room for private-public practice, because as we know, government resources are always scarce, and we always need the private sector to enhance access to healthcare, to even improve the quality of healthcare, to bring in innovation and technology as well to the healthcare space. So first and foremost, maybe I'll start with what's currently going on, which is a lot of infrastructural developments in Lagos State. We're trying to upgrade a lot of our MCCs, which are the maternal and child care centers. So private sector can actually come into place. You know, there are so many PPP models that we can adopt, which would be a win-win for both private sector and for government in terms of infrastructural development, even in terms of capacity building as well of our healthcare providers. Innovation and technology, we all know that brain drain is like the in thing. A lot of people have, well, quite a number of people have left the country. So we can leverage even on some private practitioners that are not in the country through telemedicine. This can actually help improve access to quality healthcare services, even in Lagos. Then when we now talk about essential medicines that have to do with maternal health, we have our essential list, what you should have for any safe delivery. So concerning the supply chain management, private sector can also come into play to ensure that we always have these drugs available. We are also looking into the local manufacturing and production of some of these drugs within Nigeria. So that's another area in which private sector can come in.
Thank you very much. Now you're speaking from the government perspective. Let's hear from the private sector perspective, where they think the.
Yes, thank you very much. I must admit that Lagos State is doing a lot. As usual, Lagos always sets the pace. However, we think that there is a need for more collaboration, especially with private sector. The benefits are enormous because, like I said initially, there are so many underserved areas, and you have private facilities there. If there is collaboration, there is training, if there is funding, and if we do it the right way and not a master-slave relationship, where, for instance, you have a government agency looking for perfection in a private hospital, but you go to a government hospital and you see that the standard is not the same. So by the time people are open and they know that, look, the government and the private is not in competition, that is the kind of impression that is given. It's not in competition, it's supposed to be complementary. The private are widespread, and the private also brings, private is about excellence. Private is profit driven also. So they will care more about customer satisfaction, can glean from the private with the monitoring evaluation coming from government and the policy coming from government. So when you merge the two in a transparent way, where it's going to be a win-win situation, I can tell you that the masses will benefit more, because the maternal death and child death will be reduced, because the people now have access to quality health. They don't need to come all the way to Lasuth, for instance, to come and have antenatal care, where a woman that is at Igondo, for instance, can access care and then have the same quality of care, the same, because there is training that is all around, there is supervision that is all around, the facilities, the minimum that is needed is all around. So that way, I mean, the community will benefit.
Thank you very much, gentlemen, for this session, and we've come to the close of the session. Thank you very much.
Thank you.
So while they're having their photographs, I would like to acknowledge again our sponsors and our partners, because we must call their names plenty times. Yes. Farm, we have Remedial Health, we have Kensington, we have Mother and Child Health Projects, we have Medical Mirror, and we have Impact Award Foundation. Thank you so much for your contribution towards the success of this event. I'd also like to acknowledge again our virtual audience. We know you are with us and we thank you for your contribution, for your active participation. Moving forward, let me call on. Sorry? No, we're not taking questions. Sir. Okay, no problem.
Please, my name is Reverend Joe Ideblem. I'm the General Secretary of the Imperfect Public Health Advocacy, Lagos State. From the conclusions of what I've heard from these three panels, there are need for advocacy. One, so the patients, stakeholders, the people at home to understand all these needs that are being talked here. Then there's also advocacy to let the government to do more. So I only want to add one thing that I found out as that one of the best people to meet for these advocacies is the faith-based leaders, the leaders, the imams, and the pastors. I'm just saying this generally for the people, for the self-hand, and especially for the students. Please, the advocacy is that a big imam can call the governor and say, I learned that there's no maternities around. And the governor will be now forced to go and look at all those requests all along. The same thing with the pastors. So what I'm trying to say is there's a lot of advocacy now to pass some of this information down. Let the women know that this here, that PAC here, and so on and so forth. And let the government do more. And I'm saying, from my background and from what Nuru did in Lagos State, they found out that the religious leaders has more to do when it comes in convincing people on their health needs. So that's my only addition. Thank you very much. God bless you.
Thank you. Calling on the abstract presenter for the seventh one, we'll be having a presentation on knowledge, attitude, and practice of prevention of mother-to-child transmission of human immunodeficiency virus amongst women attending antenatal clinic in Lagos University Teaching Hospital by Bukola Akinwande. Thank you.
Good afternoon, everyone. Standing on the existing protocol. Okay, my name is Kola Akwande, and I just completed my medical school, and I would be presenting my project topic titled Knowledge at Prevention of Mother-to-Child Transmission of HIV among women attending antenatal clinic in Lagos. Okay. So, a background to the study, we all know that HIV and immunodeficiency virus in full form has become one of the most formidable challenges to public health, with about 38 million people globally still living with disease. And this means of transmission of HIV, but we know that mother-to-child transmission of HIV is one of the major means by which HIV is transmitted in our environment, and prevention programs against are of utmost necessity to reduce maternal morbidity and mortality, like we've been discussing today. Okay, so my objectives for this study were one, to determine the level of knowledge, the attitude, and the practices towards the prevention of mother-to-child transmission of HIV among antenatal attendees in Lutz, and also to identify the against the practice of prevention of mother-to-child transmission of HIV. This was a descriptive cross-sectional study carried out among 292 women attending the antenatal clinic. This was an administered semi-structured questionnaire, and the respondents selected using the simple random sampling method, and data was analyzed using the EpiInfo. Okay, so for results from the study, it was observed that the overall knowledge and overall attitude towards prevention of mother-to-child transmission was good. For the knowledge, we have 86.3% and attitude 85.96%. And this was quite interesting because the reason for the study initially was during my pediatrics posting and our visit to the April clinic, I noticed that during our posting there were quite a lot of people coming in, mothers and children coming in to receive care for HIV prevention, not prevention, but treatment for HIV, both for themselves and for their children. So I was really bothered to the cause of, okay, if the knowledge and the attitude towards this prevention is good, what exactly is still the cause of the high rate of mother-to-child transmission of HIV in our community? So what I found out was from the questions asked majorly, I noticed that many of them knew about the antiretroviral therapy given, but it was found out that just 8.7% believed that the ARVs could be afforded at no cost. So it was quite a concern because, of course, we know that treatment for HIV in our community is free. So that was one of the, thank you. So that was one of my major findings from the study as to why, okay, this might be a result of the cases that we are having. I also found out that majority of respondents are tested for the HIV, although a lower percentage of their husbands tested for HIV. There was a statistically significant association found between religion, level of education, and the overall knowledge, where Christians and people with tertiary level of education had more knowledge. Also, being married and having a higher gestational age were significant variables that contributed to the positive attitude. So in conclusion, knowledge and attitude towards prevention of mother-child transmission was good, although we see that a good number of respondents shared their results with their partners, but few of the partners tested for HIV in comparison with the not tested for HIV. And this is one of the very, very key aspects of prevention. Because when we talk about prevention of mother-to-child transmission, it's not just the mother and the child. Because I remember also during the pediatrics posting at the April clinic, we realized that most of the women there said that they got the infection from their partners, from their husband. And some of them, when they come for antenatal, you tell them, okay, what of your husband? He's also supposed to do this test. They'll tell you that the husband is not interested in doing the test. So even if the mothers are well educated, even if they are well aware of the preventive therapies, their partners play a very vital role, even in making prevention of mother-to-child transmission of HIV a success. So my recommendation include voluntary counseling services, which should be incorporated into all antenatal services, both from the PHCs up to the tertiary level. Because I remember during sharing the questionnaire and asking some questions that I thought patients should know, I just noticed that a very few number of them had adequate voluntary counseling and testing. majority of them just, okay, they just tell me said we should not really go deep into that because we tested negative, which should not be so. We're educating the partners of pregnant women and to also carry them along in the voluntary testing and counseling, because the chain is definitely going to still go around if partners are not tested. Also, community service provider network should be provided to support women, especially those living with HIV, to prevent this stigma in the nation. Thank you very much.
Thank you so much, Bukola, for the wonderful presentation. Our next presentation, without wasting much of our time, will be on perception and intending practices of female genital mutilation among pregnant women attending antenatal clinics in primary health centers in Oshodi, Isolo local government area, Lagos State, Nigeria. To be presented by Akosile Elizabeth.
Good afternoon, distinguished ladies and gentlemen. My name is Elizabeth Akosile, and I'll be presenting my project topic today. My topic is perception and intending practices of female genital mutilation among pregnant women attending antenatal clinic in primary health centers in Oshodi local government area, Lagos State, Nigeria. Okay, so by way of introduction, female genital mutilation, shortened as FGM, is defined by the World Health Organization as all procedures which involves the partial or total removal of the female's external genitalia, or procedures that can cause other injuries to the female genital organs for non-medical reasons. And there are different complications of FGM, and they can either be physical, such as pain, bleeding, infections, because the practice of FGM is usually by traditional birth attendants, and they use objects that are not sterilized, like blades, as you can see in the picture, and even knives. So they can have infections like HIV and even hepatitis B being transferred among girls. Complications can also be psychological, such as the victims being depressed later in the future, and they can also be afraid, and also sexual complications, such as women not having reduced sexual satisfaction. So here is a picture showing different types of female genital mutilation, and the first type is known as clitoridectomy, where the clitoris is excised. Then the second type too is known as excision, where the labia minora and the clitoris are excised. And then the third type is known as confibulation, where the labia majora, labia minora, and the clitoris are excised. And then there is sewing of the female genital organs. And then there is the last type 4, which are other injuries, such as introduction of corrosive substances to the female genital organ. Okay, so globally, approximately 125 million girls and women have been exposed to some form of FGM, and there's another risk of 30 million young girls being mutilated in the next 10 years. In Nigeria, there are an estimated 19.9 million survivors of FGM, and Nigeria accounts for the third highest number of women and girls who have undergone FGM worldwide. Despite the ill views given to the practice of FGM, there is still considerable support for the practice, especially in areas where it is deeply rooted in their tradition. The objective of this project was to first determine the extent of knowledge and also to assess the perception and to determine the intended practices of FGM among these pregnant women. The study was a descriptive cross-sectional study. The project was a descriptive questionnaire study, and it involved 2 stages. The first stage was a simple random sampling technique, which was a balloting method to choose the primary centers where the project to be carried out, and there were 10 primary centers where the study was conducted. While the second step was to choose the respondents, and the sampling technique used was the consecutive sampling method. A pre-tested interviewer administered semi-structured questionnaire was used for data collection, and the period of data collection was for 5 months. Ethical approval was obtained from HREC of LUTS and Lagos State Primary Health Care Board. After collection of data, a total of 400 questionnaires were administered, retrieved, and they were analyzed using the EpiInfo 7 software. And after analysis, it was seen that the mean age of respondents was 30.7 to plus or minus 5.02 years, and most of the respondents fell within 26 to 30 years age groups. Majority of the respondents were Christians, and majority were from Southwest geopolitical zone. Also, majority of the respondents were married, while most of the respondents' highest level of education was secondary, and 57.3 registered for antenatal in their second trimester. The overall knowledge of FGM was good among the respondents, with 72% having good knowledge, while 28% had poor knowledge. Some of the questions used to assess knowledge was first about if they knew what it was, such as if it was involved cutting of flesh. Most of them also knew that it was a painful act, and they also knew that the victims could suffer depression later in the future. And they also knew that infections like HIV can be transmitted during the process of FGM. The overall perception towards the prevention was positive. 84% of respondents had positive perception, while negative 60% had negative perception towards its prevention. And some of the questions used to assess their perception was if they disagreed that if they feel it should be discontinued, and you can see that 58.6% disagreed that it should be continued. Meanwhile, 53.8% agreed that it causes reduced sexual satisfaction for women, and less 31% agreed that it can promote a woman's faithfulness to her husband, while 31.6% agreed that it's a practice that is supported by their religion. Majority of the respondents do not plan to circumcise their daughters in the future, and the reasons why was because they felt it was a needless practice, and they also knew about the health complications of this practice. It was seen that the knowledge of FGM was better among respondents whose husband had tertiary education, and the perception was also better among respondents from the Southwest geopolitical zone. The intention to circumcise their daughters was less among respondents and respondents whose husband had tertiary education. In conclusion, the knowledge was seen to be better among the younger women, and this can be due to maybe the education that is given to them about female genital mutilation. It was also seen that over 1/3 of the respondents had been circumcised, but this did not mean that they were going to circumcise their daughters because they knew about the harmful effects of the practice. It was also seen that most of the girls who were circumcised between their 1st and 5th year. This means that they were very little and they had no say about the practice. So it was like a violation of their rights. It was also seen that age group, the level of education of the respondents, and their geopolitical zone were among the factors that affected their perception and intended practice towards FGM. The recommendations first to the government: more efforts should be made in recent times to organize campaigns to say no to the practice of FGM. Over the time, I think there has been a bit of little advocacy about FGM, maybe due to the pandemic, but we employ the government to raise up the banner and continue to tell people about not engaging in the practice because of its health consequences. Also, to healthcare professionals, they need to increase and further intensify the education and counseling of mothers during antenatal care visits, because mothers have a role to play in the well-being of their daughters. But if they are educated and told about the harmful effects, then they can decide not to mutilate their daughters. Then to the community, there should be support given to the families and communities whose daughters have been mutilated. They should not be stigmatized and they should not be treated poorly, but they should be they should be shown support and love. Thank you for listening, and I believe that together we can all come together to fight against the practice of female genital mutilation. Thank you very much for listening.
Thank you. Thank you so much, Elizabeth. The last presenter for today would be talking to us on navigating the complexities of maternal mental health, empowering mothers in Iwaya community, Yaba, Lagos. And this would be presented by Jimo Oluwatife. I hope that our observers are making their observations and their assessments, because at the end of the presentation of the abstracts, we would identify a winner for the presentation.
My name is Jimo Oluwatife. I'm a pharmacist, founder of Modern Child Health Project. I'm a certified sustainability leader by United People Global. And I'll be presenting on one of our projects titled Navigating the Complexities of Maternal Mental Health, Empowering Mothers in our Community. But before we go ahead, I would like us to watch this video. Thank you. Sorry about the delay.
These mothers need someone to talk to them about their mental health, about their child health.
Today, in our community, we are conducting some medical screening. So our mission is actually to improve the knowledge and perception of the society on maternal and child health. I think something that is very lost in today's community is lack of health information and health education. the love for humanity, the love for continuity, the love for life is what is motivating this.
We are basically concerned about the health of the mothers and the children to reduce the mortality rates, to basically help them live healthy and have a wonderful life. Everybody knows what family planning is all about, but they don't really know the method.
Most people keep it ignorant of their hearts. So we are going to enlighten them, educate them. Postpartum depression is one of those mental health issues that is not well spoken of in Nigeria and in this community. In this part of the world, not everybody has access to quality healthcare. So we're able to talk to different women and get information and data in which we are going to evaluate and see how that plays out in this area, in this community.
When we gave some women the surveillance that were available, we were really happy. One particular woman said, like, she even prayed for us. It's a nice thing to be able to like give that to the community and all of that. So there are so many people that like doing a lot of things, especially with the economy and everything.
It's a great opportunity to have such an initiative as this today, because on the results we've seen from the outreach, it's shown that yes, this outreach was very expedient and very essential. In my opinion, I feel like we actually have done a good job so far.
This initiative showcases our unwavering belief to improve the health of mother and children by providing quality healthcare and providing them with enough information that will help improve their quality of life.
This is the beginning of those women being able to identify that they have to take care of their body, of their babies, and also people living around them.
Healthy child, happy mother.
Right. Thank you very much. This can move to the presentations. The video you just watched is a visual representation of what I'll be talking about today. So the title once again is Navigating the Complexities of Maternal Mental Health, Empowering Mothers in our Community, Yaba Lagos. All right, a brief introduction into Mother and Child Projects and brief history. Mother and Child Projects is a fast-growing initiative with a vision to build a world where mothers and children are living healthily and have quality lives, and a mission to improve the knowledge and perception of the society on maternal and child health. So I started Mother and Child Projects in 2022 with my whole team. Then, this was as a result of an encounter I had in pharmacy school in clinical rotation with a pregnant woman with comorbidities, which was as a result of lack of knowledge to some certain things. And if you say our mission is to improve knowledge and perception maternal in that the knowledge gap there. So we're trying to make sure every mother in every woman in every city, what community time do have sufficient knowledge about maternal and child health. Maternal mental health issues affect 1 in 4 pregnant women and 1 in 5 postpartum women in low-income countries. That is, for every 4 pregnant women and for every 5 postpartum women, each one of them are affected by maternal mental health. Approximately 10% of expectant mothers and 30% of recent mothers worldwide suffer from a mental illness, according to WHO 2019. So this project was introduced to the community to address the gaps in maternal mental health awareness, because what we do at Mother and Child Project is to raise awareness on maternal and child death towards mitigating maternal and child mortality rates and support towards mitigating maternal and child mortality rates in Nigeria. So prior this community outreach project in our community, we paid courtesy visits to the Oba of Iwaya, and then we had an extensive discussion, and we found out that there's actually a need for us to do this community outreach in Iwaya community. The Iwaya community is situated in Yaba Local Government Council Development Area, Lagos, Nigeria, and Iwaya has a population of about 10,000 inhabitants. So the objective here is was to empower mothers in getting the complexities of maternal mental health. And I'll just run through it. The method, the project comprises a range of activities, including health talks, majorly focusing on maternal mental health, free medical screenings, distribution of essential care items. So it's important to know that as Modern and Child Project, even though we focus on maternal mental health, we understand the importance of collaboration. So we collaborated with other organizations, not-profit organizations. We're a not-profit organization on our own. So we collaborated with not-profit organizations such as Malaria Watch, also Safer Hands Health Initiative, Children Foundation, so as for us to like utilize the opportunity to also do some other important things to improve the lives of mothers and children in the community. The screening was conducted on nursing mothers at our community, Lagos State, Nigeria. The screening tool, because it's postpartum depression we're focusing on, is known as Edinburgh Postnatal Depression Scale, EPDS, a valuable and efficient way of identifying patients at risk of perinatal depression. Yeah, here's the results we got. We also indicated that all percent of the participants exhibited significant signs of postpartum depression. I'm surprised when we got this result because some studies have shown that it's not supposed to be up to this, but things are. So with approximately 10% reporting instances of suicidal ideation, these findings underscore the critical need for targeted interventions and robust support systems within the community. So in conclusion, the maternal health outreach in our community marked the significant milestones in addressing gaps in maternal mental health awareness and support. Sustaining these positive changes required continued collaboration, advocacy, and ongoing efforts to ensure long-term impact and positive outcomes towards mitigating maternal and child mortality rates in Nigeria. Collaborations with healthcare professionals, which is something we hold very dear and high value at Modern and Child Project, and partner organizations played a pivotal role in the successful implementation of these activities. So if I'm to leave one thing, for one major thing I want you guys to stick with is the importance of collaboration, because together everyone achieve more and teamwork makes the dream work. Thank you very much.
Thank you so much, Mother and Child Health Projects. Now it's time for the presentation of awards. And I would like to kindly call on the M1 Lagos president in the person of Dr. Fumi Ige to present an award to the Deputy Director of Nursing Service, DDNS, Rashidat Akinremi, Ado Odo Ota, Lagos, Ado Odo Ota, Local Government Health Authority, Ogun State, in recognition and appreciation for her contribution and immense support towards our various Safe Hands initiatives, community programs, particularly the antenatal primary health care outreach and our training for the TBA's program. Please, kindly an award of appreciation from the SHI to DDNS.
We appreciate all that you are doing, man. Yes, hard work pays. God bless you.
I would like to call on the Senior Special Assistant to the Lagos Government on Health, Dr. Oluwatoni Adeyemi, to join Dr. Fumi Ige in presentation of the award to Shodende, who is the past permanent secretary and immediate past M1 Lagos president, in recognition and appreciation for her contribution and immense support towards our various SHI community programs. Okay. Senior Assistant to the Lagos Government on Health, Dr. Oluwatoni Adeyemi, presenting an award to Dr. Fumi Ige.
Presenting to Dr. Shodende, and I will receive it on her behalf.
Thank you so much.
Okay, this award of special recognition and appreciation is being presented to Dr. Ibirunke Shodende for her contributions and immense support towards the success of Safer Hands Initiative community programs and previous summits. We're presenting it today, the 25th day of April, 2024, on behalf of SHI. Congratulations.
Briefly, I'll be calling on the Executive Director of HCA in the person of Dr. Moshood Habib, who is ably represented by Kamal Adebayo, to give us a closing remark before we announce the winner of the best abstracts. So that is coming after the closing remark. We are slowly winding down. We have a representative of Dr. Ibirunke Shodende. So for pictorial purposes, we are going to take those pictures again because she's coming all the way from outside Lagos. Yeah. So because of that, kindly bear with us.
Good afternoon, everyone. All right. Esteemed audience, as we come to the close of this event, I can't help but feel a surge of hope the energy in this room, the passions of our discussions. Those are the building blocks of a brighter future for mothers and babies in Nigeria. We've heard from experts on the vital role of skilled birth attendants, antenatal care, and education. We've discussed the power of dispelling myths and empowering women to advocate for their own health. Now, the question of what do we do next? The answer lies in each and every one of us. We need to take the knowledge we've gained here and translate it into action. Let's become champions in our own communities. Let's live here not just informed, but ignited. Together, we can build a future where motherhood is a source of joy, not fear. Finally, thank you to all our impactful sponsors and partners. And special thank you to Safer Hand Initiative for bringing together the fourth edition of this summit. Let's make a difference together beyond the summit. Thank you.
Once again for our headline sponsor, Ethifarm, for our silver sponsor, Remedial Health and Kensington, and for our mutual partners, we have Mother and Child Health Project, Impact Her Foundation, Value Female Network, Medical Mirror, and Lagos State University Sickle Cell Association. Without your partnership, without your resources, without your contribution, this event would not take place. And pending when we get the winner for the abstract, I would also like to acknowledge some of our partners I did not mention before. We have Healthcare Analytics Consults, Medical Women Association of Nigeria, especially the Lagos State branch, and the Value Female Network Africa. Thank you so much for your contribution. So now we would announce the winner for the abstract presentation.
Thank you very much. It's been quite an enlightening learning gathering, interesting researches and findings. There were 5 or 6 abstract presentations and a silent panel of judges. So whatever you do anywhere, it's good to just do your best. Someone somewhere or some people somewhere are watching. So at the end of, after listening to all the abstract presentations, the panel of judges came up with the best abstract presentation, and the topic of that presentation is upskilling community birth attendants in Agbawa Ikusi community for excellent maternal health care delivery. And the presenter of that abstract is Ashade Itunu. Please, a round of applause for her. Beautiful job. All right. So on behalf of SHI, the organizers of this program, we present this to you, the Synthetium Prize of Excellence, presented to Ashade Itunu for the best abstract presentation at this Women's Summit, Maternal Summit. And for information, it carries a cash prize award of 30,000 naira only. Congratulations. Yes, loud it. This also is a cash prize, so that it's not be as if it's only money that was given. So this is the cash prize. Congratulations, it's no more grace to Evo. We now power this. Thank you very much.
Thank Thank you so much, Dr. Fumi. And congratulations to you, Dr. Ashade Itunu. Rounding up, we would like to call on Dr. Kemi. She's with us virtually to take on the next agenda for today. And she would be calling for commitments to improve maternal health in Nigeria by both the SHI team and their partners. Thank you. Dr. Kemi, please unmute yourself.
Okay, can you hear me? Am I being heard? Am I being heard, please?
Yes.
Okay.
We can hear you, Dr. Kemi.
Oh, I just wanted to be sure. Good afternoon, distinguished guests, speakers, panelists, and everybody that has been able to attend the summit. First, I'd like to apologize that I'm unable to make it down. I really planned when I wanted to be there, but somehow, due to things beyond my control, I couldn't make it down today. But I really want to say thank you to everybody that has made our time to come here today. I want to say thank you to the organizing partners, to the president of M1 Lagos, Dr. Ige, to the HCA Consults ED, Dr. Abib. Thank you to all of our partners, sponsors, Etifam, Fam Valentina, to the people that were behind the scene working, people like Fam Busola, that's the General Secretary for HCPAN, and people from the Lagos Health District 1, Lagos State Government, all the guests, the panelists. I might not be able to mention everybody's name, but I really want to appreciate and say a very big thank you. And because I would not want to change people that are there physically, I think I'll just leave the call to commitment part to Dr. Sekiade Jumobi. She's actually a volunteers manager, and she will be there to do the part. But I felt the need to do this vote of thanks personally, and that is why I decided to, come up to say thank you to everybody that's been a part of this program, contributed to it, giving suggestions, ideas, helped with invitation, one way or the other. If I mention your name or I do not, just know I'm extremely grateful to you. And we hope that from this program we have had, we'll be able to, develop something bigger from it, meaning that everything we have heard today, we would actually use it. And by the time the communique or the outcome document is ready, and we share it back, to everybody that has participated, to also help us or inform all of our activities from now henceforth. Thank you so much once more, and I hope that we all have a safe journey back to all of our various destinations. Thank you very much.
Thank you so much, Dr. Kemi, for bringing partners and everyone together here. And lastly, I'd like to call on Dr. Sekinat to take the call for commitments. Dr. Sekinat, is she available? Okay. Since Dr. Sekinat is not available, we can now proceed out for our lunch. That brings us to the end of the 4th SHI Maternal Health Summit of the 2024 International Day of Maternal Health and Rights. Thank you. We can proceed outside for our lunch. Thank you.
woman should die while giving birth. Imagine a plane full of pregnant women and the promise they carry crashing every day. Well, that is the equivalent of what happens in Nigeria. In 2020, around 82,000 women died preventable deaths while giving birth. That's 220 mothers, daughters, sisters, and wives lost every day for 365 days. That is more than a statistic. It's a crisis. No woman should die while giving birth.
Orúkọ mi ni Ìyáàfin Onífádé Fáfọláhàn tí mo jẹ́ agbẹ̀bí nílùú Òṣogbo.
Ní èyí tí èmi gangan tí mo bá yín sọ̀rọ̀ ti wà lẹ́nu ẹ̀. Ọdún yìí ló pé 30 ọdún tí mo ti wà lẹ́nu ẹ̀.
Mo lọ sí teacher training. Mo jáde ní NC Iléṣà. Ṣùgbọ́n iṣẹ́ agbẹ̀bí wù mí púpọ̀ torí iṣẹ́ àwọn òbí mi ni. Mi ò dẹ̀ ní àǹfààní àti lọ school nígbà yẹn. Mi ò lẹ́ni tó lè ràn mí. So mo wá decide pé kí n lọ sí training, kí n ṣe training lọ́dọ̀ àwọn tó jẹ́ doctor private hospital. Mo dẹ̀ lọ fún training yẹn fún 3 years nígbà yẹn. Ìgbà tí mo wá parí, mo bẹ̀rẹ̀ sí ní ṣiṣẹ́ káàkiri, kí n lọ auxiliary nurse, kí n lọ sí hospital kékèké, mo ń ṣiṣẹ́ tí mo dẹ̀ ń gbowó tí mo fi ń manage. Ọkọ tí mo wá fẹ́, bàbá ẹ̀ wá jẹ́ pé irú iṣẹ́ ìgangan náà ń ṣe. Bàbá yẹn ló wá dá mi dúró pé instead tí mo fi ń lọ káàkiri yẹn, kí n fẹ́ kan dúró táwọn ìbílẹ̀ ni wọ́n, pé kí n mọ báwọn manage. Mo ṣe wá di ògbóǹtarìgì nínú agbẹ̀bí ìbílẹ̀.
Mo ní staff méjì lọ́dọ̀ mi báyìí. Tó yẹ pé wọ́n wà ní clinic báyìí bí mi ò ṣe sí ní. Àwọn akọ́ṣẹ́mọṣẹ́ ni mo gbà. Nọ́ọ̀sì wà lọ́dọ̀ mi.
Mo ń ta àwọn ọjà wẹ́rẹ́wẹ́rẹ́. Mo ń ta àwọn baby care. mo dẹ̀ ń tà àwọn aṣọ mo ní ṣọ́ọ̀bù tí mo tún fi ń manage mọ́ra wọn bẹ́yìn bẹ́ẹ̀ tí iṣẹ́ àgbẹ̀bí yìí òun gan ni kókó tí mò ń ṣe àti mo gba àwọn èèyàn síbi tá a ti ń ta ọjà wẹ́rẹ́wẹ́rẹ́ yẹn ni bẹ́ẹ̀ tí iṣẹ́ àgbẹ̀bí kò sígbà tán lè dé wọ́n máa bá mi ń bẹ̀.
ṣùgbọ́n nípa ìlóyún àwọn èèyàn máa wá tààrà ṣùgbọ́n nípa ìbímọ ń máa ń jẹ́ tí máa dínkù díẹ̀díẹ̀ nítorí pé ọ̀pọ̀lọpọ̀ tí ń bá ń gba àgbo lọ́dọ̀ wa tá à ń tọ́jú ẹ̀ ẹlòmíì ó lè ṣeé ṣe kó jẹ́ pé ọjà ni bíbímọ rẹ̀ ọba kí wọ́n rọ̀ sí ẹ lọ sí hospital tàbí lórí ìrìn tàbí hospital ti eléléèbó ni wọ́n fẹ́ wù kóun bímọ sí àyàfi ẹni tí ọba jẹ́ pé ọ̀dọ̀ wa ni ó nífẹ̀ẹ́ sí jù ni yóò wá sí ọ̀dọ̀ wa.
ìgbàkigbà tí wọ́n bá ṣetán láti bímọ tán bá ti dé ilẹ̀kùn ti ṣí náà nìyẹn a ní rẹ́gísítà a ní káàdì tá a máa ń fi fún àwọn tó bá wá rẹ́gísítà tán wá lò wá bímọ owó táṣẹ́rẹ́ náà ni la máa ń gbà lọ́wọ́ wọn láti fi rẹ́gísítà 500 naira káàdì lẹ́yìn yẹn a máa sọ fún wọn pé tán fi máa deliver o owó tá a fi máa ṣe treatment fún wọn wọn a máa san díẹ̀díẹ̀ ó pọ̀ náà kò pọ̀ púpọ̀ bóyá bíi 10 bóyá 15 gbà mí tá a máa ń gbà lọ́wọ́ wọn lówó kéékèèké wọ́n dẹ̀ máa ń wá dáadáa. ní ọ̀dọ̀ wa mo gba dókítọ̀ tó ń bá mi treat àwọn èèyàn à ń gba abẹ́rẹ́ àjẹsára à ń ṣàtìnáńtà tàbá dẹ̀ ní patient tó bá ti fẹ́ di pé kínní màá rí ìfà rẹ̀ mo lọ hospital tó máa ń rí ìfà wọn sí tá a máa ń lò.
nífà yẹn tiẹ̀ ó yá sáwà lọ́wọ́ tiwa ní Òṣogbo yìí tí èèyàn kan bá ní patient tí ò bá rí ìfà ẹ̀ ẹgbẹ́ máa gbé sísẹ̀ so a máa ń refer patient tá a bá ti mọ̀ pé a lè handle ẹ̀ a máa refer sí hospital.
nígbà míì iṣẹ́ tọrọ yóò wá tó jẹ́ pé bá ti ń fi orúkún kan kúlẹ̀ náà ni wọ́n máa fi kejì dìde òmíì ń gbà míì a sì máa ní delay status tó já sí wípé a ti fọkàn sí wípé bóyá láàrin wákàtí kan tàbí ìṣẹ́jú márùn-ún ìní ó delivery ṣùgbọ́n bó ti wọ́n lọ́ọ̀ ní ti sọ̀lẹ́ rẹ̀ ó lè tó wákàtí méjì tàbí mẹ́ta tàbí ọjọ́ méjì gan níjọ́ míì tó já sí pé a máa ń pè ní àmúlẹ̀ tí máa ń mú aláboyún nígbà mìíràn so bí tí ṣe máa ń wáyé ọ̀tọ̀ọ̀tọ̀ ní bọ́mọ tí wáyé ọ̀tọ̀ọ̀tọ̀ bóbìnrin tí lóyún ọ̀tọ̀ọ̀tọ̀ ṣùgbọ́n àkàgbà pé inú àpò la ọmọ iná ni ọmọ máa ń gbé lára yẹ.
tábà dẹ̀ wà nínú oyún bẹ́ẹ̀ yẹn wọ́n máa ń ṣe scan tó ẹ̀mẹ́rin láti lè mọ̀ bóyá bó lọmọ ẹ ṣe wà bó ló ṣe wọ́n máa ń ní kán lọ ṣe VFC fún àyẹ̀wò ẹ̀jẹ̀ wọ́n á ṣe blood group wọ́n á ṣe urine test tó ti yé ẹni tó bá ní òdìmà tí mo rí i pé a ti treat ẹ̀ tí ò dẹ̀ change màá refer rẹ̀ sí hospital torí yẹn lè máa ní confusion tó bá ń bímọ lọ́wọ́.
ọ̀pọ̀ nínú èyí tí àwọn orthodox doctor àti orthodox nurse tí wọ́n máa ń mú wá nínú àwọn ọ̀rọ̀ gẹ́gẹ́ bí àwọn ti ṣe kọ́ lẹ́kọ̀ọ́ wípé bí ọmọ bá dàbù kò sí nǹkan míì tí àwọn ó ṣe sí ju pé láti ṣèfù ọmọ àti ìyá ẹ̀ àfi káwọn separation tàbí ọmọ jókòó ṣùgbọ́n lọ́dọ̀ àwa ti ìbílẹ̀ a ní àwọn ọgbọ́n tí à ń lò tó fi já sí wípé bọ́mọ bá dàbù tọmọ bá jókòó a ní àwọn tí à ń lò tí àwọn bàbá wa fi lé wa lọ́wọ́ tó já sí wípé irú ọmọ bẹ́ẹ̀ yóò sì wáyé pẹ̀lú rọrùn láì ní ṣe operation fúru obìnrin bẹ́ẹ̀.
àwọn nǹkan tí torí àwọn lọ sáwọn seminars àwọn nǹkan tí gọ́ọ̀mẹ̀ntì sọ pé a gbọ́dọ̀ ṣe àwọn ò kì í ṣe a kì í kọjá àyè wa.
nítorí bá fi wá lè mú ojú ara obìnrin tó ti gba ọwọ́ márààrún láti pé kí ọmọ ó jáde tí ọmọ ò bá wá jáde ó ti ní àkùdé díẹ̀díẹ̀ tí ẹ̀yin lélẹ́bù ń pè ní delay status so kí ni tí wọ́n ń fà á ìlókù tí a máa wá wò láti máa wo surroundings ojú ara ìyá tí ó fẹ́ bí ọmọ sáyé tí a bá ti wá rí pé kò sí ìdínà kankan ń bẹ̀ tí a sì rí wípé kó gbin bá a bá ti rí orí ọmọ ó ti ń bọ̀ wá tò sínú a máa wá lo àwọn tó jẹ mọ́ ẹ̀rọ tí a ó máa fi clean ojú ara arábìnrin yìí tí yóò fi lè já sí ìrọ̀rùn kí ọmọ kó wá sí ilé ayé.
Need someone to talk to them about their mental health, about their child health.
Today in our community, we are conducting some medical screening. So our mission is actually to improve the knowledge and perception of the society on maternal and child health.
I think something that is very lost in today's community is lack of health information and health education.
The love for humanity, the love for continuity, the love for life is what is motivating this.
We are basically concerned about the health of the mothers and the children to reduce the mortality rates, to basically help them live healthy and have a wonderful life. Everybody knows what family planning is all about, but they don't really know the methods.
Most people keep ignorant of their hearts, so we are going to enlighten them, educate them.
Postpartum depression is one of those mental health issues that is not well spoken of in Nigeria and in this community. In this part of the world, not everybody has access to quality health care, so we're able to talk to different women and get information and data in which we are going to evaluate and see how that plays out in this area, in this community.
When we gave some women the souvenirs that were available, they were really happy. One particular woman, she was like, she even prayed for us. It's a nice thing to be able to like give back to the community and all of that, because there are so many people that like need a lot of things, especially with the economy and everything.
It's a great opportunity to have such an initiative as this today, because from the results we've seen from the outreach, it's shown that yes, this outreach was very expedient and very essential.
In my opinion, actually, I feel like we actually have done a great job so far.
This initiative showcases our unwavering belief to improve the health of mother and children by providing quality health care and providing them with enough information that will help improve their quality of life. This is the beginning of those women being able to identify that they have to take care of their body, of their babies, and also the people living around them.
Healthy child, happy mother.
Ìlera wa àti àwọn ọmọ wa ló ṣe pàtàkì jùlọ.
148.